Hello dear students, welcome to Ganesh Nursing Academy. Last class we had discussed about important MCQs on ECG. About few questions, like 8 questions we were discussed about important MCQs on ECG. So today we will continue with the important MCQ discussion on ECG. Okay, so let's begin with the next questions. Okay, so question number 9, the method used to assess rhythm in ECG. Okay, so here the key word is rhythm. Okay, the method used to assess rhythm in ECG. Okay, and the options are paper and pencil method, caliper method, both A and B, and none of the above. So option A, paper and pencil method; option B, caliper method; option C, both A and B, and option D is none of the above. Okay, so first, what is this rhythm? Okay, so we are going to assess the rhythm here. We are going to assess rhythm, that is atrial rhythm and ventricular rhythm. So two rhythm we are going to assess, atrial rhythm and ventricular rhythm. So what is this rhythm? Okay, so this, take an example, this is a P wave, QRS complex, T wave. Okay, P wave, QRS complex, T wave, P wave, QRS complex, T wave. Okay, P, Q, R, S, T, again P, Q, R, S, T, P, Q, R, S, T. So first, what is atrial rhythm? Atrial rhythm means the distance between. Okay, so the distance between two consecutive. Okay, this is first when you want to assess the atrial rhythm, you have to mark the distance between two consecutive P wave. Okay. If the distance between two consecutive P wave is equal, okay, so there is equidistance between P wave. Okay, for example, here, here, and here. When you check the distance between two P wave, if it is equidistance, then atrial rhythm is said to be regular. Atrial rhythm is said to be regular. So likewise, if you want to assess the ventricular rhythm, just you have to see whether the distance between two R wave, okay, the distance between two consecutive R wave, if it is equal everywhere, then the ventricular rhythm is said to be regular. So this is a basically rhythm. Okay. So now how to assess the atrial rhythm and ventricular rhythm? So we have two methods for them. For that is paper pencil method and caliper method. So what is paper pencil method? So we have to take a piece of paper. Okay. And now what you have to see here, we have to mark two P wave. Okay, so wherever the P wave is there, no? So here is a P wave, I will mark here, and here also P wave, I will mark here. Okay, so just I have measured the distance between two consecutive P wave. Okay, this is the marking I have done. After this, I will keep this P wave here, and there everywhere I will keep the P wave in the ECG strip, and I will measure the distance between two consecutive P wave everywhere in the ECG strip. If it is found to be equidistance, if the distance between two consecutive P wave is equal, then the atrial rhythm is said to be regular. So likewise, I will make the distance. Okay, I will mark the distance between two consecutive R wave. Okay, so here is the R wave. So I have marked the R wave here. Again, I have marked the R wave here. So now I will check the distance between two consecutive R wave everywhere. Okay, I will just check the distance between two consecutive everywhere in the ECG strip. Okay, so I use paper and pencil to check the distance between two consecutive P wave and distance between two consecutive R wave. And if it is said to be equal distance everywhere, then the ventricular rhythm is said to be regular. Okay, so this is known as paper pencil method. Okay, what we have to take here, we need a paper and pencil. Just mark between two consecutive P. If you want to assess the atrial rhythm, okay, keep the paper in the ECG strip and mark two. First, you just mark the distance between two consecutive P wave. One distance you will take, and then we have to measure the same distance in between two consecutive P wave all over the ECG strip. And if it is said to be equal, if it is equal, then atrial rhythm is said to be regular. Likewise, if you want to measure the assess the ventricular rhythm, so just mark two distance between two consecutive R wave. Okay, then after that you have to just measure the distance between two consecutive R wave everywhere in the ECG strip, and if the distance between two consecutive R waves is equal everywhere, then ventricular rhythm is said to be regular. So this is the way we are going to assess the rhythm of a ECG by using paper and pencil method. Okay, and one more method is caliper method. What is this caliper method? So caliper method means in your compass box we have one caliper. Okay, so that caliper we have to keep. Okay, we have to check the distance between two P wave. Okay, that we have to measure with the help of that caliper, and we will check the distance between two consecutive P wave everywhere in the ECG strip. If it is regular, okay, if it is equidistance, then atrial rhythm is said to be regular. So like that, we have likewise same only. We have to take a caliper and just measure the distance between two consecutive R wave and check with the whether the distance between two consecutive R wave is equal everywhere in the ECG strip. If it is equidistance, then ventricular rhythm is said to be regular. Okay, so we use paper and pencil method and caliper method to assess the rhythm of the heart. Okay, so both these A and B are correct. So these two methods are correct. So option C, that is both A and B, is a correct method. Okay. Okay, dear students, let's continue with the next questions. Question number 10. Duration of normal PR interval is. Okay. So what is the key point here in the question? That is PR interval. Okay, let's see the options. Option A, 0.04 second to 0.08 second. Option B, 0.06 second to 0.08 second. Option C, 0.12 second to 0.20 second. Option D, 0.24 second to 0.28 second. Okay. Now how to assess this PR interval? Okay. So usually we assess this PR interval in conduction. Okay. So in ECG, interpretation of ECG, we are going to interpret by rate, rhythm, conduction and configuration. Okay. So in conduction, we are going to assess three intervals, that is PR interval, QRS duration and QT interval. So these three things we are going to assess, okay, in conduction of ECG interpretations, that is PR interval, QRS duration and QT interval. Now how to assess this PR interval? Okay, so take an example. This is a P wave, this is a QRS complex and this is a T wave. Okay, so P, Q, R, S, T. Okay, so when we want to assess the PR interval, okay, so we have how to assess the PR interval. First, we have to mark the point where the P wave begins. Okay, we have to mark the point where P wave begins. Okay, then we have to mark the point where Q wave begins. Okay, that is QRS complex, where the Q wave begins. Okay, so we have to mark the beginning of P wave to the beginning of Q wave. Okay, so this we have to mark. After that, we have to count number of small boxes. Okay, how many small boxes are there? 1, 2, 3, 4, 5. Okay, so if there is a 5 small boxes are there between the onset of P wave to onset of Q wave, if there is a 5 boxes are there, okay, then this 5 into one small box duration. One small box duration is 0.04 second. Already we have discussed in last question. Okay, and one large box duration is 0.20 second. Already all of you know this. Okay, so we have to just count the number of small box. First we have to mark the beginning of P wave to the beginning of Q wave, and now we have to count number of small box which is present between these two distance. Okay, and then if there is a, for take an example, if there is a 5 box are present. Okay, so 5 into one small box duration is 0.04. So this will lead to 0.12 second. So this is a PR interval. Okay, so the PR interval is, now what we got is a 0. Okay, so it is 0.20 second. Sorry. So 5 into 0.04 is 0.20 second. Okay, so 0.20 second is the answer for this question. Okay, so what is the normal PR interval then? So normal PR interval is okay, it is 0.12 second to 0.20 second. Okay, so 0.12 second to 0.20 second. Okay, so this is, so that is nothing but 3 small box to 5 small box. If they are present between the beginning of P wave to beginning of a Q wave, it is said to be normal PR interval. Okay, now how to assess the QRS duration? Okay, so this is about the PR interval. So now let's discuss about the QRS duration. How to assess the QRS duration? This is a P wave. This is a QRS complex. This is a T wave. Okay, so P, Q, R, S, T. So this is a normal wave. Now we wanted to assess the QRS duration. Okay, if you want to assess QRS duration, first you have to mark the point where the Q wave begins. Okay, so we have to mark the beginning of Q wave to the completion of S wave. Beginning of Q wave to the completion of S wave. Now count the number of small bucks. Okay, for example, 1, 2. Okay, so 3 small bucks are present. Okay, so that is nothing but a 0.3. 3 into 0.04. That is 0.12 second. So this is the QRS duration what we assessed. How we are going to assess the QRS duration? Mark the point where Q wave begins, then mark the point where S wave completes. Okay, so this distance we have to mark and count the number of small bucks between the beginning of Q wave to the completion of S wave. So suppose we get a 3 small bucks, then multiply 3 into 0.04. So 0.12 second what we got is the QRS duration. And what is the normal QRS duration? Normal QRS duration is 0.08 second to 0.12 second. So this is the normal QRS duration. Okay. So let's assess last one, that is QT interval. How to assess QT interval? If you want to assess the QT interval, okay. So this is a P wave. This is a Q, R, S, and this is a T wave. So P, Q, R, S, T. Now we wanted to assess the QT interval. Okay. So when you want to assess the QT interval, okay, this QT interval. So what you have to do? We have to mark from the beginning of Q wave. Okay, where the big Q wave begins, we have to mark, and completion of T wave, where the T wave completes. Okay. So from the beginning of Q wave to the completion of T wave, we have to mark, and we have to count the number of small bucks. Okay, for example, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 small bucks are there. Okay, so if 10 small bucks are present, 10 into 0.04, because one small buck duration is 0.04 second, so that will give us 0.40 second. So this is the QT interval what we have obtained after the assessment. So how to assess the QT interval? Mark for the point where the Q wave begins, okay, and mark the point where T wave completes. So this becomes QT interval. And now count the number of small bucks between the beginning of Q wave to the completion of T wave. Okay, this between in this mark, how many small bucks comes? Suppose 10 small bucks comes, 10 into 0.04 second. Why we multiply 10 into 0.04 second? Because one small buck duration is 0.04 second. So total duration of QT interval is 0.40 second. What is the normal QT interval duration? Normal QT interval duration, it is 0.36 second to 0.44 second. Okay, so 0.36 second to 0.44 second, that is 9 small bucks to 11 small bucks if they are present between onset of Q wave to the completion of T wave, it is said to be normal. Okay, so this is all we are going to assess in the conduction of a ECG interpretation. Okay, now what question they ask? Duration of normal PR interval. Okay, so already I have told you that the normal duration of PR interval is 0.12 second. Okay, 0.12 second to 0.20 second, that is 3 to 5 small bucks between the onset of Q wave to the onset of Q wave. Okay, so this remaining options, that the options A, B and D are the wrong option. Okay, dear aspirants, let's say next question. Question number 11, classic ECG changes in myocardial infarction. Okay, so myocardial infarction means, all of you know that there is a blockage in the coronary artery that is completely stopped supplying blood to the myocardial tissues. If that happens, what ECG changes we will expect in the ECG? Okay, and options are: option A, ST segment elevation; option B, T wave inversion; option C, development of abnormal Q wave; and option D is all of the above. Okay, so first let's see what is a normal ECG. This is a P wave, this is a Q, R, S and T. Okay, this is a normal wave, P, Q, R, S, T. This is normal. Okay, normal ECG. Okay, so first what happens? Whenever a person suffer from myocardial infarctions, okay, immediately after the myocardial infarctions, within a few hours after the myocardial infarction, okay, within few hours, what changes you can expect? there will be normal P wave, okay, and there will be what you can see ST segment elevation will be there, okay. So this is a P wave, Q, R, okay, ST. See, S and T wave are, okay, elevated here, okay. So ST segment will be elevated, okay. So there is a ST segment elevation will be there, okay. This is the T wave here. So ST segment elevation will be there. So within a few hours after the myocardial infarctions, we can see there is a the ST segment supposed to come here. It is significantly elevated, okay. It is significantly elevated. This indicates that the person is suffered from the myocardial infarctions within an hour, okay. From hours to day, what is the changes from hours to day, okay. From hours to day, what you can say changes you can see here, P wave will be there, then slightly there is the appearance of Q wave will start begin, then R, ST segment will be remain elevated, ST segment will be remained elevated, and after that there will be T wave inversion, okay. ST segment elevation and T wave inversion. P, Q, R, ST segment here, okay, and this is a T wave. So ST segment supposed to come here, it is elevated here, okay, and T wave has been inverted, okay. So from hours to day, what changes you can see after the MI, there will be ST segment elevation and T wave inversion, okay. From day to week, okay, day to week, what changes you can see? This is normal ECG, okay. From days to week, what changes you can see in the myocardial infarctions? There will be P wave will be not affected here, so Q will start appearing deeper, it will go deeper, and R wave. Now ST segment starts coming down, and T wave is also start appearing normal, okay. So T wave is also coming into positive deflection, ST segment is also settling down, okay. So this is a P wave, Q, R. Now ST segment you can see here, it is coming down, okay, and T wave is also settling to normal, okay. Next, days to month, what you can see here. So almost this P wave will be normal, Q wave will be, it is wide and deep, okay. Q will be wide and deep, R wave and ST and everything will be normal, okay. So here this is normal P wave, this is a Q wave, R, S, T. Now after days to month after the myocardial infarctions, P wave will be normal. See here, this Q wave will be, it is widened and deepened. It become wide and deep. See, normal Q wave is very small. Normal Q wave is very small. Okay, it is not wide and deep. This you can see it is a wide and deep. Now T wave, ST segment. See, ST segment and T wave appear normal. Okay. So what significant changes you can see in the days to month after the myocardial infarction is wide and deep Q wave, okay. So the wide and deep Q wave, the wide and deep, the length of this deepness of this Q wave will be 1/3 of R wave. It is 1/3 of R wave, that much deep it will go, okay. So if you see, normally the Q wave is not that much deep here, okay. Normally it is not deep here. So how to identify old MI is, if you see, if there is a wide and deep Q wave in a person ECG, that indicates that the person had suffered from myocardial infarction, okay. It indicates the old myocardial infarction, okay. So this is all about the ECG changes in myocardial infarction, okay. So ST segment will be there, of course it will be there. Then T wave inversion, it will be there. Development of Q wave, okay, development of abnormal Q wave will be there. So option for this one is option D. All of the above is a correct answer, okay. So after the myocardial infarction, what are the classical ECG changes in myocardial infarction is ST segment elevation will be there, T wave inversion will be there, development of abnormal Q wave, and all these will be there. So option D is a correct option. Okay, dear aspirants, let's see next question. Question number 12. Identify the following ECG pattern and find out the correct arrhythmias. Okay, so this is the image based questions. They have given the image. Okay, so this is the image they have given. Okay, and we have to find out what is the type of arrhythmias it is. Options are atrial flutter. Option A, atrial flutter fibrillation. Option B is a premature ventricular contraction. Option C is a bradycardia, and option D is a atrial flutter. Okay, now we have to identify. Okay, first one is atrial fibrillation. See here, atrial fibrillation means we can see not this kind of waves. In case of atrial fibrillation, how you can see the ECG changes? See here, there will be no, instead of P wave there will be irregular waves will be there, and there will be QRS complex and T wave will be there. Again there will be, instead of P wave there will be irregular waves, then there will be QRS complex and T wave. Okay, so this is P Q R S T, P Q R S T. So this is the pattern we can see in the case of atrial fibrillation. So instead of P wave there will be irregular waves will be there. So that is a atrial fibrillation. So here it is not like that. So it is a not a correct options. Next one is premature ventricular contraction. Okay. So what is the pattern in premature ventricular contractions? There will be normal P wave will be there, QRS complex, then T wave will be there, and in between then you can see there is ectopics. Okay, so like this ectopics will be there. Then again there will be P wave, QRS complex and T wave. So P wave, Q, R, S, T. So this is the ectopic. Okay, and again there is a P, Q, R, S, T. So here there will be ectopics. Will find in between this a normal ECG waves, normal pattern of a ECG wave. If you find these ectopics, this is known as premature ventricular contraction. Okay, so this kind of waves are not there in this one, so it is also wrong option. So atrial fibrillation is wrong, and premature ventricular contraction is also wrong option. Now let us see next option, that is a bradycardia. Okay. So what will be there in bradycardia? See here, there will be P will be there, normal QRS complex will be there, and T wave. But there will be far distance will be there. Again, there will be P wave will be there, QRS complex will be there, and then T wave. Okay. So P, Q, R, S, T, P, Q, R, S, T. Okay. So there will be normal morphology, normal P wave, normal QRS complex, and normal ST segment and T wave will be there. Normal P wave, normal QRS complex, normal ST segment and T wave. But the distance between two R wave, the distance between two P wave, okay, and the distance between two R wave, it is widened here. It is widened. Okay, and you can see there is a more number of small bugs. When you divide it 1500 by number of small bugs, it will be very less. So heart rate will be very less here. Okay, heart rate will be very low. So this is known as bradycardia. Okay, so that kind of pattern is not we are seeing here. So this is also wrong option here. Okay, now let us see, that is the last one is atrial flutter. Okay, so what is the ECG changes in atrial flutter? Okay, so ECG changes in atrial flutter is, see here, in P wave place there will be saw teeth like structure will be there, QRS complex, then T wave will be there. Again saw teeth like structure like 1 or 2, then QRS complex, then T wave will be there. So if you find in place of P wave a saw teeth like structure, okay, see what you are finding here, saw teeth like structures. Okay, here also saw teeth like structures. Okay, so in a place of P wave, if you find a saw teeth like structure, okay, apart from this QRS complex, this QRS complex, ST segment and T wave, everything will be normal. So in place of P wave, if you see saw teeth like structures, okay, in the place of P wave, it is known as atrial flutter. Okay, so this is what the findings in the P wave. You can see there is a saw teeth like structures. So this is a, what is abnormality here, what is the arrhythmia here? It is a atrial flutter. So right option for this one is atrial flutter. Okay, okay dear students, let's see next questions. Question number 13, ECG changes in hyperkalemia. Okay, so first, what is hyperkalemia? Okay, hyperkalemia. So hyperkalemia means increase serum potassium level. Okay, normal serum potassium level. Okay, what is the normal serum potassium level? Normal serum potassium level is 3.5 to 5.1 milliequivalent per liter. This is normal serum potassium. Okay, so when we can say hyperkalemia, when serum potassium level, if it is above 5.5, it is above 5.5 milliequivalent per liter, it is known as hyperkalemia. When we can say hypokalemia, when serum potassium, okay, when serum potassium level is, okay, when serum potassium level is below, that is less than 3 milliequivalent per liter, it is known as hypokalemia. Okay, so this is about the hyperkalemia. Okay, normal serum potassium is 3.5 to 5.1 millicolumn per liter. When we can say hyperkalemia, serum potassium level goes beyond 5.5 millicolumn per liter. When we can say hypokalemia, when serum potassium level goes below 3 millicolumn per liter. Now, what is the ECG changes in hyperkalemia? Okay, the options are option A, tall peaked T wave, option B, flat P wave, option C, ST segment depression, option D is all of the above. Okay, so after seeing these questions, most of the students directly jump into tall peaked T wave and they mark it and they won't see other options. So that is actually wrong method. Okay, so we have to see all the options. Okay, and we should know in detail about the ECG changes in hyperkalemia. Okay, so what happens in ECG changes happens in hyperkalemia is there will be flat P wave. Okay, the P wave become flat. Okay, and there will be QRS complex will be there. Okay, so this is a P wave here. Okay, P wave is become flat. This is QRS and this is the T wave. Okay, what you can see a T wave? T wave will be tall peaked T wave. Okay, tall peaked T wave. So this is the ECG changes in a hyperkalemia. What changes? First there will be flat P wave. Okay, so there is a flat P wave is there in the B option. It is correct. Then there will be ECG changes in hyperkalemia is ST segment depression. Okay, so here it is ST segment is depression is there. So we will draw normal ECG, that is this is a P wave. Okay, QRST. Okay, PQRST. So see here the normal P wave is normal. Here P wave is flat in hyperkalemia. Okay, ST segment is normal here, normal ST segment. Here ST segment is depressed. Okay, it is a depressed, it is downward. Okay, and T wave you see here, T wave is normal, here T wave is tall peak wave. Okay, so these are the classical changes in a ECG in hyperkalemia. What is that? Flat P wave, ST segment depression and tall peaked T wave. Okay, so here flat P wave is there, tall peaked T wave is there. Okay, and ST segment depression is there. So answer for this one is all of the above. Option D, all of the above is the correct answer here. Okay, dear students, let's see next question. Question number 14. ECG changes in hypokalemia. Okay. So what is hypokalemia? When serum potassium level goes less than 3 milliequivalent, per liter, it is known as hypokalemia. Okay. So what are the ECG changes in hypokalemia? Okay. So after making a point of hypokalemia in a question, let's see the options. Option A is flat T wave, option B is ST segment depression, option C presence of U wave, option D is all of the above. Okay. So what happens in this one? Why ECG changes in hypokalemia is, so there will be normal P wave. P wave will be not affected here. Okay. This QRS complex will be normal, but ST segment will be depressed. Okay, and T wave will be flat. And there will be appearance of a U wave. So this is a significant changes in hypokalemia. Okay, so P wave, Q, R, S. This is the T and this is U wave. Okay, usually normally we don't see U wave presence in the normal ECG, but when there is a presence of U wave, flat T wave and ST segment depression is there, that is a classical manifestation, classical changes in the ECG in hypokalemia. Okay, so what are the changes will be there? Flat T wave, yes, obviously there will be flat T wave will be there. Okay, so you can see there is a flat T wave. Okay, let's draw normal ECG, normal pattern. Okay, this is P, Q, R, S, T. There is no U wave. P, Q, R, S, T. See how the T wave here? T wave is very significant positive reflection. See the T wave here? T wave is flat. Okay, T wave is flat here. Okay, that is one manifestation. That is a flat T wave. It is present in the hypokalemia. ST segment depression. Here you see ST segment is normal. Here ST segment is depressed. Okay, so ST segment is depressed here. Okay, so that is another classical feature of hypokalemia. Next is presence of U wave. See here there is no U wave. Okay, but here you can see there is a presence of U wave. So this presence of U wave, okay, it indicates that it is hypokalemia. Okay, so option D is all of these. So the option D, all of these correct answer here, because all this flat T wave, ST segment depression and presence of U wave, all these are the classical features in the hypokalemia. Okay.